Okay, according to American Heart Association, every day 2,200 people die from cardiovascular disease in the U.S. That's nearly 8,000 people per year, or roughly 1 in every 3. So if you ever knew someone with cardiovascular disease, or you currently do know someone with the disease, then you know how serious this disease actually is. If you don't, well, I'm about to give you some facts. Anyway, I have cardiovascular disease actually runs in my family, so I feel like I'm pretty qualified to speak over this. Also, I've done quite a lot of research over the few years. Anyway, my main points include what cardiovascular disease actually is, the 3 different types of cardiovascular disease, and how to treat it. And first off, I'm going to explain what cardiovascular disease actually is. It's defined as any blood vessel or heart disease. So what happens is plaque builds up within the arteries, and then this narrows arteries, making it harder for the blood to flow. And so my chart actually shows, it breaks down the risk of heart disease through years. So as you can see, it increases as you get older, usually just due to diminishing health. And I'm actually going to go more in depth in that later on, actually right now. So main different types of heart disease include a heart attack, heart failure, and arrhythmia. So first off, heart attack is when blood flow is reduced or cut off completely to the heart. So what happens is the coronary arteries become narrow from the built up fat or cholesterol or plaque or whatever. And so then a blood clot develops. Well, you can't really get oxygen or nutrients to your heart after you have blood clot, which then makes you have a heart attack. It's usually just like your chest compressing, it feels tight, you can't breathe. It's pretty serious. Then the second one I'm going to talk about is heart failure. This is when your blood doesn't pump as well as it should, which just means your heart is unable to keep up with the rest of your body. You develop breathing problems, you feel fatigued, and this is usually due to a lack of blood and oxygen flow to your heart. Most people don't really realize they go through heart failure because your heart actually enlarges or pumps faster to try to keep up with your heart. So you actually don't know you're having heart failure until suddenly it hits you and you're on the ground, can't breathe. And finally, the third topic I'm going to cover is arrhythmia. Arrhythmia is when there's abnormal rhythm and to the heart, so like it pumps harder or is pumped slower or faster than it usually should. This affects actually how well your heart works. So my third point is how to treat heart problems or cardiovascular disease. So the first one is you keep your body healthy and you go to your doctor for regular checkups. It's honestly not that hard. You just say, hey, check my heart, check how well it's going on, and they'll be like, yeah, cool, whatever, let's do it. Also, if you already have heart disease, treatments like medications will help. Most of them are usually medications, or for more severe ones, you can go for pacemakers, or in worst case, heart surgery, which you don't want that. So to wrap it up, I'm going to cover my 3 main points again. So what heart disease is, basically any heart or blood vessel disease. 3 different types include heart failure, heart attack, and arrhythmia. And then how to treat it is basically early prevention and medications if you already have heart disease. And so hopefully you learn a little bit more about heart disease and how severe it actually is. Thank you.
We've got Spencer, and then I think that's it. We won't have time for any. We've got you two. That's all that we'll have time for.